Glad you could join us right here on Sun TV, and welcome to this here edition of Health Talk. In the studio, I'm joined by, before I introduce my guest, I might as well introduce myself, and I'm your presenter for today. Actually, my name is Sean Imas Muliti, and I'm joined by Dr. Nelson Banda, who is a consultant orthopedic surgeon at Ndola Teaching Hospital. Our topic for today is actually lower back pain. But before we go into the topic, Doc, I'm glad you could find time to join us, and welcome to this interview.
Thank you so much.
All right. Now, first things first. What is orthopedic, surgeon?
Orthopedics refers to a discipline of medicine or a specialty of medicine that deals with the musculoskeletal system.
Mm-hmm.
That is the treatment of problems that affect the musculoskeletal system, the diagnosis of the same conditions, and prevention, and we later on add rehabilitation. Musculoskeletal system is a system that is involved in the support of the body as a framework and movement of the body. So that is what orthopedics is.
Okay. All right. So when you say skeletal system, do we mean right from the skull up to the toe?
We don't handle the skull. We start from the neck.
Okay.
Then the rest of the body is ours.
Okay.
The skull and what is in the brain is left for others to handle. That's the neurosurgeons to handle.
I see.
Yes, sir.
Okay, so now at least I've learned something from there. You know, sometimes you just say like, okay, when you see here bones with thinking like probably maybe starting the lower back pain.
Lower back pain refers to the pain that one experiences at the back in the region between the last lower rib, that's the 12th rib, to the buttocks. That is, in a nutshell, that is lower back pain. We tend to split it in different categories to try to understand it better. So when the pain is less than 6 weeks, we refer to it as acute lower back pain. Then the pain that has been there for over 12 weeks, that is chronic back pain. Then again, where there is a definite cause to that pain that has been identified, that is referred to as specific back pain. Where no definite cause has been found, you've looked around and you can't find the cause, that is referred to as a unspecific back pain. So this is how we categorize, this is how we look at back pain.
Okay, so I'm glad you've mentioned the causes. So what are the major, you said specific if the causes, right?
Yes, sir.
So now in this situation, what are the major causes for back pain?
The causes can be split into multiple causes. Literally everything, all the structures that are in the back can cause pain, right from the inside of the body to the outside. If we start from the inside, the bones themselves, the vertebra, there are 5 of them in the lower back. The bones themselves can have problem either because of trauma, they fracture or they break. And then they can have infection, they can have malignancy or tumors in their bones. Okay. Starting from somewhere else, they end up lodging in the bones of the back.
Yes.
So other than that, you could have ligament injuries. You could also have muscle injuries. They can cause that. Other than what is in the skeletal system, you could also have back pain arising from the structures that are within the pelvis or in the abdomen. We're talking about the uterus. We're talking about the liver. We're talking about the kidneys. All those can cause back pain.
Okay.
Yes, sir.
All right. So I should take it that those causes that you've mentioned actually have got specific kind of treatment.
Yes. For specific back pain, once you handle the underlying cause, you will have sorted out the problem.
Okay.
Yes, yes, yes.
All right. Okay. Now, how common is it amongst, okay, who's prone to, having back pain? Is it mainly in males? Is it in females? Or even sometimes that can even like kids, have this kind of a problem?
Literally everyone can have back pain. That's the reason as to why we're here to try and to let people know that there's a problem as back pain. Everyone can, but there are certain age groups and certain individuals that are more at risk than others. 63% were women, then 37% men. So we tend to see it more in women than men. Then again, there is an element of those that smoke, those that are obese, and those that are involved in jobs that entail that you lift and you do all sorts of activities. And those that sit for a long time.
Okay.
We're talking about drivers. Again, within the hospital, it's been known to have a problem. With nurses, there's a lady, there's a doctor, there's a Nkata Loveness, I think, did a study in Osaka at some clinics. She found that about 58% of the nurses have this problem. Okay. So we're looking at how you handle yourself while at work.
Okay. All right. Whilst we're there, what are the repercussions of back pain if left unattended to in men, and also what are the repercussions of back pain if left unattended to in women?
In women. The repercussions don't really segregate as male and female. The consequences depend on the actual cause. The thing that back pain has in terms of the general economy, it's one of the biggest cause of people not going for work. Okay. We tend to give sick offs and all those things. And
but when you talk about lower back pain, the
major thing is pain. Pain in the region that we pain in the region that we mentioned, pain below the ribs and above the buttocks. That's a major thing. Pain can be sharp, dull, just pain in that area. Now, to try and understand what could be the underlying cause of that pain, you try to see what are the associated things. If you have pain, say you're trying to lift a weight, you're bending and trying to lift a weight, you have sudden pain in your back and the pop sound, you would tend to think that is arising from the pop sound. You would tend to think that is arising from a disc that has ruptured. If you have pain again, that goes down, shoots down your leg, you want to think the nerves are involved.
Okay.
Yeah, and if you have pain, then you're having difficulties in your passing urine and walking, then you want to see that the spine, you want to understand that the spine is also involved. So pain, yes, but we have to look at other associations of that pain. So the major factor is pain.
Okay.
Yes, sir.
How is it treated?
Back pain has several modalities of treatment, which we tend to look at. The most important thing that we have to do is to have disciplines like physiotherapy to be able to help us. And that's the mainstay of treatment, physiotherapy. You want to build the muscles around the back, and you want to take the patient back to his state before he sustained that back pain. So physiotherapy, analgesia, and the social support. These are problems that people grapple with, but they need support. They need psychological support. So that, in a nutshell, is how you look at it. I want to emphasize the self-treatment, because most of the time, this patient will not be in the hospital, they'll be at home. So the patient education as how they should look after themselves and how what they should avoid, that is very, very key. Among the things we want to emphasize, like I said, is watching your diet, losing your weight, and how you handle yourself at work.
Before you proceed, when you talk about watching your diet, which kind of foods should one try to avoid in order to, prevent lower back pain?
Everything that would increase your weight. Because, like we said, obesity is one of the risk factors. Yes. Anything that increases your weight, we're talking about high fat foods and high carbohydrate foods, those will increase your weight. So you want to avoid those. And in the content and high fat content are a risk. Yes.
Okay. All right. You're watching Health Talk. Nelson Banda, who's a specialist, a consultant, orthopedics department at Ndola Teaching Hospital. Now, if you want to be part of this here program that we today, this edition of Health Talk, we're discussing lower back pain. You can simply call us on the number 069 122 851 076 0769 122 851 0769 122 851. So now, as we understand with back pain, can the chairs that we sit on also contribute to having this kind of pain?
Yes. It's one of the major things that we've seen. We refer to those as ergonomics, as how somebody postures themselves backwards, predispose you to back pain.
Okay.
It does, especially if you're talking about back pains that come as a result of disc prolapse and ligamentous injuries in the back. Those they tend to reoccur. With lifting, they should avoid bending. That is not that this sort of back pain, especially from disc prolapse, they tend to recur, and it's part of treatment to try and avoid the predisposing factors, the things that would cause them back pain. So most of the conditions really recur.
For a lot of people that are like to exercise, especially in the gym, lifting weights and all that kind of stuff, how can this be prevented? And are they putting themselves mostly at risk of having this kind of problem?
Yes.
And if so, how would you advise them to exercise in order to prevent this?
Yes,
prevent this.
Yes, we've had patients that are weightlifters that have come to us with back pain. And it's possible for one to have back pain even when you lift weights. It's about the amount of weights. That you are lifting. If they are beyond your level, you have that disc prolapse, you have that back pain. So it's about gradually increasing your load, not sudden, and supervised sort of exercises. People just tend to lift bending down and all that. It's a technique. So they need to, if there's an instructor, they need to find an instructor who knows what is it that will provoke back pain. And try to avoid that. Yes, if you are lifting weights and you are not well supervised, you can actually be the one that is causing that back pain.
Okay.
So weights have to be lifted in a particular way with supervision.
All right. Okay. Earlier on, you did mention to say like even smoking can cause back pain. How is that possible? Because I thought smoking is a issue that goes to deal with respiratory kind of issues.
Yeah, yes, it's been attributed to one of the risk factors to having a lower back pain. And those that have explained it have related to the repeated coughing that a smoker does have. And that increases the pressure within the spine. That is also a predisposing factor to a disc prolapse.
Okay.
So it's the cough, repeated cough, then you have a disc prolapse that will...
What is disc prolapse? You're using so many these words. For a person that's listening to us and does not understand the medical technical words.
All right. The bones of the back are in small segments, in pieces. In between those pieces, there are some soft tissue that are cushion-like that allow us to bend forward, side, and all that. That is what is referred to as a disc. Yes. In the disc is composed of material that is like jelly in the center and a canvas around it to try and contain that material.
Okay.
Now, when the canvas around the jelly breaks, the material inside tend to come out. And when the material comes out, the next thing it does is compresses on the nerves that come from the spinal cord to the legs. That is what causes back pain.
Okay.
Yes. So it's the disc prolapse is the break in the disc, and the material comes out.
Okay.
That is one of the risk factors. The things that cause it to break is excessive pressure on the disc. Like we are saying, somebody just lifts a weight that is beyond them with techniques that are not good. That will cause the disc to break.
Okay.
The disc does break as somebody gets older. It's more prone to breaking as you get older.
Okay.
Remember we said above the age of 50,
Mm-hmm.
back pain is common. This is one of the reasons as to why back pain is more common in that age.
Okay. If a person is, what to do in order to avoid back pain?
Yeah, that's a very good question. This is why we are here now, because we are seeing these problems. Know that once you get to certain ages, you have to exercise.
Mm-hmm.
Sedentary lifestyle, like you just sit and you don't do anything, that's
Mm-hmm.
not good. That's
Mm-hmm.
not good. It will predispose you to back pain. So we want people to exercise.
What kind of exercise would you recommend?
Somebody can go jogging, walking and all that. As long as the muscles of the back are slowly being built, not suddenly, not sort of a binge exercises.
Mm-hmm.
No, gradual building. You're building yourself week by week.
Mm-hmm.
That is what helps.
Okay.
Sudden exercises, you stop, that will predispose you to disc prolapse.
Okay.
So you have to be gradual in your building your physical activities.
I see.
Within your limits.
Okay. Now, this is one probably question that probably maybe a lot of people would not, would want to run away from. Sexual activities. How are they a contributor? Probably, maybe sometimes to back pain. Or are they? Can they be?
Yeah, I've not really. That's a good one.
Yes.
I'm sure people want to hear that.
Yes.
I would want to think that yes, they would cause back pain,
Mm-hmm.
depending on the positions and all that.
Mm-hmm.
But I've not come across any paper that points them to being major contributors.
Okay.
Yes. The positions themselves and the activity themselves should be health related or age related.
Uh-huh.
You cannot do certain things in your old age.
Uh-huh.
Your body will not allow
Mm-hmm.
you. So yes, you have to be cautious with your back as you get
Mm-hmm.
older.
Mm-hmm.
That's what I would say.
Okay.
Yes. But I've not really come across any paper or anything that really tells me this sexual activity are a major contributor to back pain.
Okay.
But I think it's a possibility.
It's a possibility.
It's a possibility.
All
Yes,
right.
yes.
Okay. Cool. All right. As we come slowly to the end of this, here chat, I would want you to re-echo the complications that may arise if it's this problem is not treated well.
All right. The complications are, if not treated well, especially in the initial stages, you could have a repeated back pain, chronic back pain.
Mm-hmm.
That should have been handled in the earlier stages. You understand what it is, then
Mm-hmm.
the pain goes away. So number one is chronic back pain.
Mm-hmm.
Number two, you could have neurological fallout, meaning you could have numbness of legs, inability to pass urine,
Mm-hmm.
depending on the cause of that back pain.
Mm-hmm.
And that's what we don't want to have. We want people to come as quickly as possible for treatment and help,
Mm-hmm.
especially if the pain is not improving.
Mm-hmm.
You've been on your medications for 3 weeks, the pain is not improving.
Mm-hmm.
Then if you're losing weight, if you have a cancer, they've diagnosed you, say with the breast cancer, you have back pain, want you to come to the hospital as quickly as possible.
Okay.
If you have failing to pass urine, you have back pain, quickly rush to the hospital. That's what we want to let the people know.
Mm-hmm.
So those are the major complications that I want to think about now.
Mm-hmm.
The major thing is that loss of sensation or altered sensation, be it in your legs and your feet, quickly rush to the hospital.
Mm-hmm.
That is what we don't want to have to happen, because when you reach such stages, it's difficult to treat a patient.
Mm-hmm.
So those are the major complications that we see. Chronic pain, repeated pain, that actually debilitates. You can't do anything
Okay.
because of the pain. That's what we want to avoid.
Okay.
Therefore, we want to treat this condition as early as possible.
Mm-hmm. Okay. All right. That's very much interesting, Doc. And as we close this here topic, any words that you would want to share with us with regards to this case issue here?
Yes. I'm sure there are many people out there that suffer from back pain. The first thing is to to go to the nearest health institution that is near to you. If the pain has persisted, come to Mdola Teaching Hospital, be able to help you. Don't take these things lightly, because they have consequences.
Yes.
Yes. We want people to be aware that back pain is a big problem in our country. And we want people to rush quickly to the hospital. They can be attended to and given the appropriate help that they need. Then, they are not alone. There are so many people that have this problem, because people tend to sit back and okay, maybe it's just me and all that. There are a lot of people that are having those problems, and there is treatment. There is available treatment at the hospital. There is treatment that we can give. We want people to be aware. We want people to come forward and receive this treatment.
All right, Doc. So in this same situation, so it's you've mentioned to say like they can come and how accessible is this kind of treatment at Mdola Teaching Hospital?
It's very, very accessible. We are open 24/7.